Obamacare, which I think you just said you would? And if so, what would you replace it with?
So we have to repeal Obamacare. And you know why, but let me explain, not because you don't understand it, but because one of the things that we have to do, I believe, honestly, in 2016, to win in 2016, and we must win, is we have to explain our values and our principles to the American people so that they understand why we believe what we believe and why it is better for most everyone. The reason we have to repeal Obamacare is because it is a crony capitalist's dream. This bill was written by drug companies and insurance companies who are now consolidating. The bill itself was longer than a Harry Potter novel. Not really very interesting, so nobody read it. And then another 30 to 40,000 pages of regulation got written somewhere in the basement of HHS, and nobody's read that either. And so meanwhile now, the insurance companies, the hospitals, they're all consolidating to deal with big, complicated, powerful government. Meantime, the law is failing the people it was supposedly intended to serve. Emergency room visits are up over 50% in some places. Health insurance premiums are up over 40%. We're throwing more people into Medicaid, a program that is increasingly financially insolvent, and more than that, fewer and fewer doctors are accepting Medicaid. So we're not helping people. We must repeal it, both to help people and to stop the spread of crony capitalism in our health industry. Second, here's a great example of what the federal government shouldn't be doing and the states should be doing. I think we need to give the responsibility to the states to manage high-risk pools. Many states did this well before Obamacare. The closer you put decision-making to the people affected by those decisions, the more accountable those decisions are. Push that responsibility to the states and the funding as well. Third, let's try the one thing we've never tried in health insurance. What have we never tried? The free market. In fact, health insurance has been a cozy little game between regulators and health insurance companies for 100 years. We used to play it on the state level. And so regulators and health insurance companies would get together in a state like South Carolina or California or Texas, and the regulators and the health insurance companies would say, well, 4 of you get to play. This market's pretty small, only 4 of you can compete. What does that do? It removes choice and power and competition from the consumer. So and all Obamacare did really was nationalize that game. So now we have a cozy little game being played by regulators and health insurance companies on the national level. Who's not getting served? Any of us. So, let's go to the free market, truly, real competition, where you get to say, this is what I want, this is what I'm willing to pay for, this is the kind of coverage I need, and companies will compete for you, finally. And this is very important, and I don't use the term mandate in association with the federal government very often, but I am going to use it in this context. The federal government should mandate that every healthcare provider, hospital, walk-in clinic, senior citizens, every healthcare provider must publish on a regular basis their costs, their prices, their outcomes. Healthcare is a really important thing. I'm a breast cancer survivor. I know how important it is. Yes. I know how important it is that people get care. I know how important it is that people get help when they need help. But I also know that healthcare is so important to each of us and our families, we don't have any idea. We don't know whether this hospital is better than that hospital. We don't know what their outcomes are versus those outcomes. We don't know what the prices are. It is a big black box. And the government has been reimbursing healthcare providers on the basis of their costs for years. So what does that do? You have no incentive to get better at anything. You need to know. I need to know. We all need to know. What are your costs? What are your prices? What are your outcomes? So that you're in charge, not them.